I'm going to try to cover a lot of details about baby corn in just one video. Baby corn came to me from the city shelter in mid-April. He was around 3 weeks old and 150 grams. He had two sisters that were normal at under 300 grams. His sisters were adopted at the beginning of June. I don't know anything about his mother because they were surrendered as orphan kittens. When he came to me, baby corn's eyes were open and his teeth were coming in, but his ear canals were closed and stayed closed for another week. Because his teeth were on the same timeline as his sisters, I knew they were all the same age, but we don't have an explanation for why his ears opened so late. I named baby corn after a memory I had as a child. My grandmother had a garden in our backyard, and she broke her hip when I was around 10, ending her gardening career. Since I spent the most time with her in that garden, I felt obligated to continue it. I planted everything so late that by the time the cold weather came in, everything I grew was very small. The corn was only half developed. It was baby corn at the top and full-size corn at the bottom. So when I took in this tiny, confused kitten out of the carrier, I immediately thought of that half-formed corn. All the parts were there, just growing at a different pace. Baby corn drank from the bottle the first day that I got him, but then he stopped. So I had to tube feed him for 5 days. At the end of the 5th day, he started drinking from the bottle on his own. He only started to really grow about a week later when he started weaning with his sisters. He was super dull for the first few weeks that I had him, and I think it's likely that he had delays in visual development, and having closed ears means that he was deaf as well. He had no stimuli to respond to, so he would just stand around and not move, and sometimes he would peck at things, and that was how he got around. Baby corn gains an average of 30 grams a week. He's a little under 1,100 grams, or around 2.4 pounds at 26 weeks old. This is about the weight of a 9-week-old kitten. Most 6-month-old kittens are around 6 pounds at this point. We have kittens at Meow Parlor who are even younger than baby corn, and they're like 8 pounds. Baby corn's also wobbly. Lots of kittens are wobbly when they first learn how to walk. In his case, we had to do a judgment call between his actual age and his size. So he was diagnosed later than most kittens with cerebellar hypoplasia. We didn't know for sure that he was truly wobbly until we saw him do a handstand because he was so excited about eating. Cerebellar hypoplasia is a non-progressive disorder likely caused by a pregnant cat being exposed to panleukopenia. It causes the kittens to have an underdeveloped cerebellum, which means that they're going to be wobbly, have tremors, or lack coordination. They're often even more wobbly when excited or trying to concentrate. It's not curable, and the only long-term issue I've seen is that some are more likely to chip their canine teeth because of the way they eat. However, there are not a lot of conditions that can cause a kitten to be both wobbly and tiny, and we thought it was less likely that he had two separate conditions that caused him to be both. Because of his size, it was hard to draw enough blood for tests, so we had to prioritize testing based on the likeliest diagnosis. We started with his thyroid levels because that's treatable. When his results came in, he was at the low end of normal for a kitten his age, and he also didn't have any other symptoms that supported hypothyroidism. He also doesn't have any symptoms that support a liver shunt, and because his sisters are not wobbly, we felt that toxoplasmosis was unlikely. He does not have hydrocephalus. We did a wisdom panel test, and he was negative for everything it tests for, including gangliosidosis, mucopolysaccharidosis types 1, 6, and 7. We sent his urine to PenGen to test for metabolic disorders, and he was a slight positive for MPS, but the lab believed it was age-related and not a true positive. However, they suggested he could have a neurological storage disease, which urine does not test for. Storage disorders are progressive, and most cats don't live for more than a few years. We sent out his plasma, and he ended up being negative for all of the storage disorders they tested for. Our vet said a CBC and chem blood work were normal for a kitten. So we've accounted for the most likely diagnoses for baby corn that cover his small size and his wobbly walk. These are all progressive disorders, so by 6 months old, if he had them, we should already be able to see him declining. One of the reasons I like to post walking videos is because I know that you're going to be able to tell me honestly if you think he's getting worse, and the consensus is that he's stable. Now it seems more likely than not that he has cerebellar hypoplasia. But we still don't know why he's so small. We have not tested his insulin growth factor or for pituitary dwarfism. He doesn't really match some of the other known cases in the world because the development of his teeth have always been appropriate for his age. He's behaviorally very similar to a kitten his age now despite a delayed start. He's mentally alert and knows his name. He also has a tiny head, but maybe it'll get wider like some of the other well-known dwarf cats. As of now, the one thing I can foresee as being an issue is that he has slightly more curved spine than I think he should. I don't know if it's because he's wobbly or because he's small. Also, we did x-rays 2 months ago, and all of his organs, including his liver, looked normal. That being said, here's some other facts. Babycorn had a white whisker on his left side. It fell out recently. Since he had a fever coat, I'm wondering if it was a true white whisker or part of the fever coat. He gets lonely a lot and will yell until either a person or a cat hangs out with him. He doesn't really run. He just kind of bursts across space. He can jump, but he always seems surprised by what direction he goes in. I have to put him on the bed or on the couch because he can't get up by himself. Many kittens with cerebellar hypoplasia are slow to learn how to use a litter box. Babycorn learned at 19 weeks old. He was mostly using pee pads, which is why you see them all over the place in my videos. I think he learned how to use a litter box by watching Not Berry. He will still have an accident if he can't see his litter box, but he's doing so much better now. His litter box is a shallow tray that I think was meant as an activity tray for preschoolers. By rough estimates, kittens are usually half to 75% of their final weight by the time they're 6 months old, and if that's the case, Babycorn's probably going to be under 3 pounds. He hasn't been neutered yet because he's unilaterally cryptorchid, which means that only one testicle has descended. We're hoping the other comes out on his own so he can have a normal neuter surgery instead of a cryptorchid surgery. Our vets usually prefer doing the cryptorchid surgery when the kittens are 6 months old, but because he's so small, there's no real guidance here, so we're just going to keep waiting. His harness is meant for a hamster or a ferret, but it was the only one small enough to fit him. His tongue didn't always used to stick out, but I think it is now because he's teething. We'll see if he'll have a permanent blep in the future. Thank you so much for loving Babycorn, and I hope I answered all of your questions.